for the last time, which I doubt will be the case, that there is no intentions on my government's part to privatize OKEU. And there never has been. So hopefully, again, I'm on record. I make it publicly known clearly that there is no intentions to be able to privatize OKEU. Okay? So this sinister perspective, Mr. Speaker, by members of the opposite side, to look at something that is a simple issue, to dig deep further, to believe there's some alternative motive other than simply protecting the workers of Saint Lucia, I have to say to you, is farcical. And to watch members on the other side, especially experienced members, to try to defend the indefensible, rather than to accept with humility that a mistake was made. We all make those mistakes. That's why I said it in my preamble. We're not any one of us perfect, and I gave them the benefit of the doubt that these were done with the best of intentions. We heard the member from Beaufort South try his best to justify making no amendments. And with the greatest amount of difficulty, and I have to say that he failed in being able to define the difference between transfer and secondment. So, the understanding of my side with regards to transfer is an act that can take place with a public servant within the government. So I can transfer somebody from commerce to tourism. I can transfer somebody from infrastructure to economic development. And so a transfer applies to within the government service. But you cannot transfer a public servant outside of the public service. And the member from Beaufort South also correctly indicated, how can you be a servant of two masters? The purpose of being seconded is simply in order to be able to preserve your pension. Now, the member from Beaufort South maybe ought to listen to himself sometimes and try out before he says these things publicly. So the fact that he is suggesting that the solution to this problem was to amend the Pensions Act and to leave this one alone. So which one was there first? Was the Pensions Act there first, or the Millennium Heights Act first? So therefore, if you now have a Pensions Act in existence, and it has certain definitions, why wouldn't you draft the legislation to be consistent with the Pensions Act? And the Pensions Act accepts the ability to second members of the public service outside, and that when you do that in seconding them, that their pension is preserved. That is what we are trying to cure here. In the explanatory notes, Clause 4 of the bill amends the same section the member from the Leader of the Opposition wants to understand. His answer is here. Don't have to get it from anybody else. It's right here. Okay? So it says what? Section 34 of the Act, transfer of a service and preservation of a pension rights. To delete references to the transfer of a public officer and to only make reference to the secondment of a public officer. Clause 4 of the bill also provides for a public officer to agree in writing to a secondment. Nothing sinister. The two terms are used that are not mutually exclusive, inclusive. They are mutually exclusive. They make reference to different things, and all we're attempting to do here is to cure that. But members on the other side, Mr. Speaker, despite you trying to advise them, broaden the debate to determine where's the money coming from, how are things going to work out. So, Mr. Speaker, let me take them through what my government's policy is, which is very different to what their policy was. So, in fact, Mr. Speaker, members on the opposite side continue to talk about the importance of healthcare, but their actions did not support that. We've seen, in the case of St. Jude's, had 5 years. What excuse can anybody offer, Mr. Speaker? What excuse can anyone offer for not having the hospital built? Was it the absence of spending money? We know that that's not the case. The fact is, we know that they spent over $130 million. We know that they never had planning approval. We know that they never had proper certification. So all these years have gone by, Mr. Speaker, and they were not able to solve it. Moving into OKEU. How is it? What's the justification? Where was the excuse? Why did that not happen? And even in opposition, what we said was, at minimum, move the dialysis lab from Victoria into OKEU. Those members on the opposite side who actually go to Victoria and actually had gone to see where the dialysis lab was, which is, if I'm not mistaken, the old nurses' quarters, a building that the Ministry of Infrastructure had actually condemned. And that's where it was. You would go in there, and there was just wires hanging out. You could see that it's a building that was just standing out of mere habit. That we now know historically that the only thing that was missing to have opened the dialysis center at OKEU, because all the pipework had been done, all the mechanics were there, all that was missing were the chairs to be able to plug in. And in fact, we now know that if they wanted, there was 8 chairs available in a container in Viewport that was waiting for the dialysis center at St. Jude's, which they knew they were not even close to being able to open up. And even when this government came in and made it attempt from the get-go to be able to move the dialysis center into the facility, they were on the bandwagon that we needed to have the hospital operational before we could do that. Not knowing, around the world, there are several facilities around the world in which you have dialysis centers as standalone facilities. And we had to push and push and push, all the time remembering the people who were currently being serviced at Victoria, to persevere to be able to make that happen. And look at that. It's up and operating. No problems. None. In opposition, we clearly identified that we knew what the problem was, Mr. Speaker. The problem with moving into OKEU was money. And the members on the opposite side would be familiar with the University of West Indies report that was done, which said that it would cost about $70 million to be able to operate OKEU. Now, most of us, hopefully, have some level of common sense that when you know that Victoria Hospital cost $35 million to operate, and I don't think there's any one of us who's going to defend Victoria Hospital as being a facility of excellence. So it means that there are a great number of deficiencies that exist at Victoria. And that's $35 million. So we're now going to move into a modern facility, air-conditioned, high-tech equipment, much greater maintenance requirements, with less beds. So the efficiency of the operation is going to have to be greater. Do we believe that that number of $70 million is misquoted? In fact, I have to say, Mr. Speaker, I believe it's understated. I think it's going to be more. So already, healthcare cost us $110 million, of which close to 85% of that $110 million is staffing. So if you now add 35 million or 40 million, because the assumption, Mr. Speaker, all along has been that we're going to shut Victoria. That's the assumption. So the $35 million it costs to operate OKEU is now going to be transferred from Victoria to OKEU, and therefore the government has to find another 35 or 40 million dollars. What was the former government's allocation? $10 million. That's what they gave the Ministry of Health. Said, we're going to give you $10 million to move into OKU, and you have to make it work. How is that possible? How is that possible? And yet there are lots of reports, lots of consultants which show that that's impossible to happen. So the question, Mr. Speaker, is where is this money going to come from? And when we came into government, we did employ and bring in Dr. King and a group of people in order to make that determination. How are we going to transition? Do I believe that there is, for the most part, good capability in Saint Lucia? I do. From a medical perspective. But where there is a problem is in the management. The operating procedures, the organizational structure, the job descriptions, the management currently at Victoria is sorely lacking. One just has to walk through and see how many basic practices are not in existence. A person writing a software system on DOS to deal with a blood bank. Old equipment, when you go into the lab, half of the equipment in the lab is delinquent. We call it the museum, Mr. Speaker. Don't even have the capacity to get rid of all the stuff. Old air conditioners next to new air conditioners. Demolition work that's done and the stone work is still there. I mean, I happened to go up there the other day to walk through the wards, and even to my own chagrin. A simple thing like Wi-Fi, not in existence. And I'm grateful to Digicel for moving very quickly at our request and putting Wi-Fi in the facility. But how could it be that we knew that we were having problems in moving OKU and that Victoria continues to operate in its current defective operations? And how are we going to change that? So Dr. King and his group came up with the idea, a very good idea, to increase the NIC contribution, which is currently at 10%, Mr. Speaker, and to increase it by 50% to 15%. So that means that the workers, instead of contributing 5% of their salary to NIC, now would be contributing 7.5% of their money to NIC. And businesses, instead of contributing 5%, they too would also now contribute 7.5%. And after my government looked at that, the issue that my government had with that is that while it would generate the $40 million, is that whoever could not afford health care today still would not be able to afford it tomorrow. That was the problem. And we believe that there are thousands, in excess of 40,000 people in this country who don't have access to health care. Basically can't afford to go to the doctor, and if they went to the doctor, can't afford a prescription. And that's why successive governments have given the amnesty with regards to people who owed money at Victoria and at St. Jude's. So we did not believe that that was going to be the solution of the problem. So what my government has decided is that we're going to introduce a national health care insurance program. Now, I'm not even going to go down the road quoting the members on the opposite side's manifesto, where they too talked about a universal health insurance. They too, Mr. Speaker, talked about public-private partnership. I have no idea what that means. They didn't offer any further definition to that. And sadly for them, the public of Saint Lucia did not give them the opportunity to be in government to expand upon that idea. But clearly the concept of a public sector, private sector partnership was in their manifesto. So what we decided to do is to have a national health care insurance. And in order to make that national health care insurance affordable, Mr. Speaker, and this is where the public sector, private sector partnership comes in, is that the government will pay for the salaries of the nurses and the doctors, the administration staff. We'll also pay for the cost of utilities, and we will be in charge and responsible for any capital investments into healthcare. And the expectation is that the premium that will now be compulsory for every Saint Lucian to participate in will pay for private doctor visits, prescriptions, and basic medical procedures to be defined. And what we've said is that persons who are earning a pension below a certain amount, because those people don't have the capability of augmenting their salary and should not be excluded, the government will pay their contribution for them. Those people who are on the poverty list, and that poverty list now needs to be expanded to represent everybody who is poor. Because the poverty list that we have is based on how much money we have, not by the need. And so the politics of it is continuously people wondering why I'm not on the list. And it's because we've been running successive deficits. Government doesn't have the capacity to put all that money in. But we need to expand that list to include and to identify all the people that should be on that list. And government will pay for their contribution to the insurance. And if you're unemployed and your income was below a certain level, we will pay 100%. If you were unemployed and your salary is higher, we will pay a portion of it for a period of time. But everybody else who's employed will be required to make a contribution. Why do we want to do that? Because we know that government is good at recurrent expenditure. We're good at paying salaries. We also know, Mr. Speaker, that if we can get everybody on an insurance plan, and now those thousands of people who don't have access to health care actually go to the doctor and get checked up, and then statistically now, Mr. Speaker, we have all the information that we require to determine what I say is the health of our nation. How many people really are high blood pressure? How many people are pre-diabetic? How many people are advanced stages of being a diabetic? And we will now know that number. So it means that the programs that the Ministry of Health will be engaged in towards helping change people's lifestyles. We also know that there are too many Saint Lucians who are already pre-diabetic or borderline high blood pressure, who are not going to the doctor. Simple tablets can help remedy and letting them know that they need to change their lifestyle and would prevent them from becoming on dialysis or prevent them from getting a stroke. Or how many people have had to go through amputations? These are the things that we want to be able to prevent. Because in the rhetoric, everybody talks about the same thing. We all know that the long-term solution to healthcare, Mr. Speaker, is by changing people's habits. It's a lifestyle. Now, how does this system start working? If in fact now we're able to have a successful program, why? Because we can measure it. We know how many people were pre-diabetic. We know what the programs we're putting in. And within months, we can start seeing the results of those programs. If now all of a sudden the number of people who are going to dialysis starts going down, the number of people who are having to be amputated goes down, the number of people who are having not to go to work because of high blood pressure or feeling exhausted, and we're able to start solving those problems, we now start reducing the risk of healthcare in our country. And as a result of it, your insurance premiums will either come down or the quantum of services that we're going to be able to provide will grow. Now, in working with the World Bank and the IMF, and I want to thank the staff of the World Bank for their incredible assistance in this area, we wanted to make sure that whatever solution that we were bringing in, that we had the possibility of rolling it out within the OECS. Because imagine if we could get 180,000 people participating in our healthcare insurance program, and if that number now was expanded to 750,000, the levels of services that you're going to be able to get and the premiums that we're going to have to pay would come down considerably. So this is why we've chosen to implement the healthcare insurance through NIC. So NIC would be responsible for administering this basic healthcare insurance program. Why? Because there is a syndicate in the OECS of the NICs. They already work collaboratively together. So we have an opportunity of creating something that would be easily rolled out. Now, what we have to be mindful of is that we do not displace and compete against the private sector. So in providing this basic program that covers your doctor's appointments, getting your prescriptions, and as I said to you, basic surgeries, that you now have the opportunity to top that up with private sector. And government now has to figure out, for the more vulnerable people in our society, what we're going to do in order to help those people top up their support. So whether it's a self-imposed insurance plan, and as the need comes up, we help facilitate those people. Whether we take out a separate tertiary level insurance for them, that has to be determined. But the most important thing right now is to get every single Saint Lucian a healthcare insurance card. That they know they can go to the doctor. They don't have to go to a politician. They don't have to go and beg their loved ones. That they have the responsibility themselves to go to that doctor. Because ultimately, I don't think there's anybody in this room that can say that we have to solve that problem. But Mr. Speaker, this idea that OKEU or St. Jude's by themselves is going to solve the problem, it's not. You can have the fanciest hospital, but if people can't afford to go, they're not going to go. And all is lost. So let's talk now about the consultancy, Mr. Speaker. We've realized that when we've gone through Victoria and also St. Jude's, I'd like to say, Mr. Speaker, that this is not the first time that I have said this, that the operating procedures that exist are archaic and ineffective and inefficient. And I don't blame the staff. Blame the fact that they have not stayed up with modern times. In fact, the better of the two operating systems in Saint Lucia, Mr. Speaker, clearly is St. Jude's. And when you go there, you can see that the systems function. Where the files are, the prescriptions, the billing. Simply, people who are currently insured. When you go to St. Jude's collects that insurance money. Victoria is not doing that. These are people who have already paid insurance. And the insurance companies are prepared to pay. So what we need to do is to make sure that when we're transferring into OKEU, that we have an operating procedure that is going to allow it to be efficient. We have met with Canadians. We met with our very good friends in Martinique and Guadeloupe. We met with Cubans. We met with Colombians. And also we met with Cayman Health City, who have an operation in Cayman. And after all the considerations, we decided that we felt that the operating system that the Indians have is far much more efficient and much more relevant to us. Because the Indians now have become accustomed and have become world-class leaders, Mr. Speaker, in providing quality healthcare services at a very reasonable price. And the way that they've done that is by sharing services, by purchasing more medicine together. And exactly what the member from Castries Central talked about is recognizing that they're doing thousands of operations and are developing the level of expertise, and is how to share that expertise on a rotation basis. So a doctor would go and stay at a hospital that has a lot of patients, and then move to a hospital that has less. But everybody starts benefiting now from that level of expertise. And also through technology, Mr. Speaker. If you do a blood test, if you do an MRI, it's automatically digitized, it's sent to a base in India, processed, and then sent back. And so there's a lot of economies of scale that have been established. So we have contracted this company, Cayman Health City, to come in, a 2-year contract, to assist, one, in designing a operating system for OKEU. So what's the organizational chart going to look like? What are the job descriptions going to be? And also to develop the operating procedures on a daily basis, to raise the level of what we have. And we have a transition team of Saint Lucians, and that part of that is going to be that we're going to now, once the organizational chart is done, the job descriptions are done, the Saint Lucians will work side by side, overseen by the board, to help now interview the people and put them in their rightful place. And we know in advance, Mr. Speaker, that there's going to be shortcomings. We know that some people going into some basic jobs are going to require short-term training. We know that there are going to be people who are going to need medium-term training. And we know that there's some areas in which currently solutions cannot fill, but we want them to be filled. And so therefore we have to have a longer-term approach in getting scholarships and identifying those specific areas where we want to get solutions trained. But the goal of this administration is to make sure, as best as possible, that everybody who's going to be working at OKEU will be Saint Lucian. And the intention is to make sure that the board will be of Saint Lucian vested interest. And the job of the board is to take these new ideas and to make sure that these ideas are now brought in and become Saint Lucian. And take the best practices in Saint Lucia, the best practices of what we're trying to learn, in order to deliver truly quality, affordable health care to all Saint Lucians. So, Mr. Speaker, I've taken this time to go into this detail. And hopefully I can dismiss in the idea of the members on the opposite side that there's anything sinister on our side in order to amend an act simply to be able to protect the rights of the workers of Saint Lucia. That's all it is. And that we're committed to having a Saint Lucia-grown solution and benefiting from the greatest amount of expertise that we can blend with our Saint Lucian experience in order to provide this important service. And this is why we've said, Mr. Speaker, the fact that OKEU is going to have less beds, that there was an assumption that was even written into the policy that was overseen by the former government, that you had to now build up your primary health care services. We came here this morning to pass an OECS bill for $6 million. We've also borrowed $20 million from CDB, and not CDB, from the World Bank, US, and we've also been able to be beneficiaries of PAHO's smart centers, where you've now seen an unprecedented amount of investment in our primary health services. Why? That we want the first place that solutions go to is to their healthcare center. And the healthcare center needs to be the nerve center in terms of educating solutions about living a better lifestyle. But these are not things that you can put on a paper, Mr. Speaker. These are things that can only be measured by workers. And that is the difference on this side. that we are accustomed to delivering on what we have to do, spending less time on the propaganda and the politics and the blame game, and truly dealing with the urgency of healthcare, the urgency in education, the urgency in security in this country. And not last, but the urgency of infrastructure. Because without that, we cannot grow this economy. So again, Mr. Speaker, I want to dismiss any notion on the other side that there's anything sinister. I want to repeat, there's no intention by my government to privatize the OKEU, but the consultancy is simply to strengthen our own local work base. And furthermore, Mr. Speaker, in order to protect the rights of the workers, we must take away the word transfer. It does not apply in this case. We must make sure that they're all seconded. And when they are seconded, they are the responsibility of the Millennium Heights. If anything happens, they come back to the public service. That's the purpose of the secondment, as well as protecting their pension. So I thank you very much, Mr. Speaker.